Hello friends, myself Rituja Megrajam Baker from K.T. Patil College of B Pharmacy. In this my video, we are going to study about the drugs which are used in the congestive heart failure. So let's start it. First of all, we are going to complete the point in this video are introduction, difference of a normal and a failure heart, how to heart failure is diagnosed, sign and symptoms of the CHF, and the classification of the drugs, and the last one is the role of these drugs. So let's start with some basic introduction. What is a CHF? Congestive heart failure is a condition in which the heart is unable to pump the sufficient blood to meet the metabolic demand of the body, and after unable to receive it back because of every time after a systole. In the following diagram, we can see the diastolic and the systolic condition of the heart. Then the next is the normal heart and the failure heart. Difference between the normal heart and the failure heart is a normal heart can pump the blood in a smooth way, but the failure heart it has a reduced ability to pump the blood. Next is the diagnosis of the heart failure. How we can diagnose the failure heart? So by using some techniques we can diagnose it easily, like chest x-ray, ECGs, blood test, echo machines, etc. Before the diagnosis of the heart failure, we should have to know about the sign and symptoms of the CHF. If any person is suffering from the CHF, he has some sign and symptoms like short breathness, tiredness, swollen ankles, loss of appetite, coughing, dizziness, abdominal bloating, and a sleep disturbance. These all are the sign and symptoms of the CHF. Now let's discuss about the drugs which are used in the heart failure. First one is a diuretic. In this, subpoint is a loop diuretic. For example, is a furosemide. Second one is a thiazide diuretic. For example, is a hydrochlorothiazide. Third is a potassium sparing diuretic and aldosterone diuretic. For example, is a spironolactone. Now, second is angiotensin converting enzyme inhibitors, that is a ACE inhibitors. For example, is a enalapril, lisinopril, captopril. Third is a angiotensin receptor blocker. For example, is a losartan and a telmisartan. Fourth one is the beta blocker. For example, is a bisoprolol, carvedilol, metoprolol, and a nebivolol. Fifth one is the vasodilators. For example, is a hydralazine, isosorbide dinitrate, and a nesiritide. Last one is a drug which increases the cardiac contractility. It also called as the inotropic drugs. In this subpoint is a cardiac glycoside. For example, is a digoxin, beta agonist. For example, is a dobutamine. Third is a bipyridines. These are a phosphodiesterase inhibitor. For example, is a milrinone. Let's see it one by one. Role of a diuretic in the CHF. We all know that diuretics can decrease the preload and improve the ventricular efficiency by reducing the circulating volume. They also remove the peripheral edema and the pulmonary congestion. Almost all cases of the sympathetic CHF are treated with the diuretics. Especially furosemide are a drug of a choice for the heart failure. Furosemide is intravenously taken intravenously. Intravenous furosemide promptly increases the systemic venous capacitance and produces a rapid symptomatic relief in acute left ventricular failure. They are also called as a high ceiling diuretics, that is loop diuretics. They are preferred as a low dose therapy for the maintenance. They increase the salt and water excretion and reduces the blood volume. They also reduces the preload and venous pressure. They improve the cardiac performance and relieve the edema. Next one is the role of aldosterone antagonist and the potassium sparing diuretic. By the diuretics, it has been realized that rise in a plasma aldosterone in the CHF. In addition to it, well known that sodium and H2O retaining action. It can be important contributor to disease progression by direct and the indirect effect, and it can suggest the spironolactone as the therapy for the CHF. The onest benefit of the aldosterone antagonist is the CHF is a slow. Aldosterone are a significant additional measure in a moderate severe CHF with the prognostic benefits. For example of the aldosterone antagonist is a spironolactone. Spironolactone, it is a weak diuretic by its own right. It is used only in a combination with other more efficacious diuretics. It is used to counteract the potassium loss due to thiazide and the loop diuretics. It decreases the mortality by 30% when added to in the patient receiving the ACE inhibitors and other standard therapies. Potassium mechanism for these benefits is a prevention of aldosterone induced myocardial and vascular fibrosis and baroreceptor dysfunction. In addition to its renal effect, side effect of this spironolactone is a hyperkalemia can occur. It is a contraindicated in the drowsiness, ataxia, and the mental confusion. Next one is the role of ACE inhibitors. Through the ACE inhibitors themselves lower the aldosterone levels, this effect is incomplete and short lasting. For example is the captopril. It is a drug of choice in the CHF. It acts by blocking the ACE, which converts the angiotensin 1 to potent angiotensin 2. As a result is a vasodilation, that is a decrease of vascular resistance. It decreases the aldosterone release leading to decrease the salt and water retention. It decreases the norepinephrine release and decrease the cardiac remodeling. Side effect of the captopril is hyperkalemia, hypotension, and the cough. It is a contraindicated in the pregnancy, renal arteriostenosis, and the angioedema. Next one is the role of the angiotensin receptor blockers. For example is a losartan. It blocks the AT1 receptor on a heart, peripheral vasculature, and in the kidney. It produces a hemodynamic effects similar to those of ACE inhibitors. Result is a vasodilation, decrease sympathetic activity, decrease aldosterone release, decrease renal sodium reabsorption. Large clinical trials suggest that angiotensin receptor blockers are a best reservoir for patients who cannot tolerate the ACE inhibitors, usually in the cough. Side effect of the losartan is a hyperkalemia, renal failure, and a hypotension. It is a contraindicated in the pregnancy and the renal artery. Next one is the role of the beta blockers. Beta blockers blocks the adrenaline on a beta receptor. These show that the nerve impulses that travel through the heart. As a result, heart does not have to work as a heart because it needs less blood and oxygen. It results is a decreases in the heart rate and the blood pressure and the lenses. And need to nitrates also block the impulses that can cause an arrhythmia. Beta blocker are a class of drugs which are used in a various indication, but particularly for cardiac arrhythmias and the cardioprotection after the myocardial infarction. All the beta blockers are not beneficial in the CHF. Some of these are bisoprolol, carvedilol, metoprolol are preferred as these drugs to improve ventricular function and prolong the survival in these patients. Let's see the mechanism of these drugs is reduction in the cardiac remodeling, blunting of adverse effect of higher circulating levels of catecholamines. These are useful even though they have a negative inotropic action. Starting dose of this drug is very low, then titrated upward as tolerated to target level. Dose of carvedilol is a 50 mg per day, bisoprolol is a 10 mg per day, metoprolol is a 200 mg per day or a near for a maximum protection. Next group of drug is a vasodilators. Vasodilators these are play an important role in the management for acute heart failure, particularly when increased afterload is the participating cause the decompensation. It can use intravenous nitrovasodilators, and when properly dosed, these class of agents dose provide substantial symptoms for relief for the patients with the acute hypertensive heart failure. Vasodilators were first used intravenous to acute heart failure that occurs in advanced cases. Their use by oral route has been extended to long-term therapy of chronic congestive heart failure. But vasodilators other than ACE inhibitors only limited utility for differing profiles of arteriole and the venodilator action are available. For example of the vasodilators are the hydralazine nitrates, isosorbide dinitrate, minoxidil, etc. The first one is a hydrolyzing dilates. Hydrolyzing dilates resistance vessels and reduces Hydralazine dilates the resistance vessels and reduces the aortic impedance so that even a weaker ventricular contraction is able to pump more blood. Second is a minoxidil is a more potent arterial dilator but has found little use in a heart failure. Third, the combination of a hydralazine and isosorbate dinitrate should be used in a tolerant of the ACE inhibitors as it reduces the mortality. Fourth, it also reduces the mortality when added to standard therapy. Next drugs are inotropic drugs. These are the drugs which increases the cardiac contractility. That are called as the inotropic drug. We all know that the glycosides, a sugar molecule is joined together with a non-sugar molecule by the ether linkage. It's called as the glycosides. So that cardiac glycoside is a combination of a digitoxose and a steroidal lactone are called as a cardiac glycoside. For example of the cardiac glycoside is a digoxin. It a cardiac glycoside extracted from a floc's glow leaves. It is a most important inotropic agent. It increases the contractile force. It has a direct vasoconstrictor effect. There is no prominent effect on a BP as it is a secondary to improvement in circulation. It is a drug of choice for a heart failure is a very low out. It is also useful in a restoring cardiac compensation. Side effect of the digoxin is nausea, vomiting, diarrhea, abdominal cramps, etc. It is contraindicated in the hyperkalemia, renal impairment, and hypothyroidism, etc. Next drugs are the beta agonist drugs. The drugs with beta adrenergic and dopaminergic D1 agonist action have a positive inotropic and vasodilator properties which may be utilized to combat emergency pump failure. For example is a dobutamine. Dobutamine is a sympathomimetic drug. It opposing the alpha effects but agonists the beta 1 and the beta 2. It only moderate increases the heart rate but significant increases the contractility. It is relatively selective beta 1 agonist with the prominent inotropic action. Is the preferred drug for intravenous infusion in the acute heart failure occupying the myocardial infarction, cardiac surgery as well as to tide. Next are the bipyridines. Bipyridine is an organic compound with the formula C10H8N2. They are a colorless solid. For example of the bipyridines is the milrinine. It is related to the inmarin. It has similar action but is more selective for the PDE3. PDE3 are the inhibitors of the drugs which inhibits the action of phosphodiesterase enzymes. Is at least 10 times more potent. It is a shorter acting. In a long term prospective trials, it increases the mortality has been reported with the oral milrinone also. Milrinone is preferred over ambrinon and should be restricted to short term use only. So these all are the drugs which are used in the treatment of the cardiac heart failure. So now we will stop here. Thank you so much for watching this video.